that human beings face is just a deficiency, a lack of raw material in their body. We developed so many myths around modern medicine. How many of you know someone or know a family that's been affected by Alzheimer's or dementia? Does anybody know that the United States remains one of the few civilized nations in the world continuing to call Alzheimer's and dementia? Does anyone know what it really is? Type 3 diabetes. It's insulin resistance in the brain. In 22 years, I didn't see a single early onset Alzheimer's demented patient that did not have 10 years of elevated blood sugar prior to. Right? The brain is nasty. The brain is like the little Kim Jong-un of dictators. It just sits up there and takes everything for itself. Right? If it wants calcium, it'll leach it from the bone. If it wants amino acids, it'll strip it from lean muscle tissue. And if it wants sugar, it will activate a nasty little receptor called the TAS1R2 receptor at the back of your tongue, and it will give you a dopamine reward for feeding it sugar. Most of us are addicted to it, right? There are entire laboratories in the United States of America full of PhDs dedicated to nothing but the study of one receptor on the back of the tongue, trying to create dopamine addiction in the population to drive food sources.
Now you have to ask yourself, why would doctors with a PhD attempt to make people addicted to food that would hurt them? Why? Why would a doctor with a PhD take money from pharmaceutical companies to push drugs on their patients? Why? Because this is war and they want money and they don't care. Please, please, please be careful about what you put in your body. Please.